A warm welcome to all of you to the sixth session of Nath Health Leadership Reach Out series. This is a special initiative where experts, leaders, and medical practitioners with varied experiences in the healthcare industry can engage with frontline health workers to understand concerns, challenges, offer advice, mentorship, counseling, and any required support to motivate them and express solidarity. As we all know, the COVID-19 pandemic has overburdened our healthcare system and also impacted the mental health of healthcare professionals, especially the frontline health workers who are at the forefront, saving thousands of lives every day. Through 2020, when the first wave of the pandemic hit us, and 2021, as we battle a more virulent wave, and our frontline health workers are literally on the battleground, working 24/7, tirelessly caring for patients, and of course helping speed recoveries while placing their own lives and those of their families at risk. Many of them lead lonely, isolated lives with long duty hours and only go home to sleep before starting over the next day again and again, not having met or spent time with their loved ones. Days are filled with uncertainty and anxiety for them with no immediate solutions. It's my privilege today to moderate this session on behalf of Nat Health, the Healthcare Federation of India, and we're pleased to have Dr. Shravan Subramanyam, President and CEO of GE Healthcare India and South Asia, and Managing Director of Wipro GE Healthcare as the key speaker today. Dr. Subramanyam is the President and CEO of GE Healthcare, as I mentioned. He's based in Bangalore. Shravan has over 15 years of corporate and healthcare experience. A physician with a passion for diagnostics, he's particularly keen on promoting precision medicine and the use of technology in healthcare. His career spans leadership roles in global pharma and medical device organizations, including Roche and Novartis. In fact, he was there with them in the US and Hong Kong, amongst others. At GE Healthcare, Shravan manages a large panel of almost 800 million with 4,500 plus member workforce, spanning across 6 geographies. He's responsible for GE Healthcare's commercial operations in India and South Asia, and acts as the site leader for GHS, India Engineering Design and R&D Center, 3 manufacturing sites and supply chain operations as the MD of GE's joint venture with Wipro and Bharat Electronics. Dr. Subramanyam also holds a master's degree in health administration from Cornell, where he previously served on the alumni board. He's an active voice at various industry bodies such as FICCI and NatHealth, and recently stepped down as president of the Swiss Indo Chamber of Commerce in India. He's been named in the Economic Times 40 under 40 list of India's hottest business leaders. Great one, Shravan. In 2018, he lives in Bangalore with his wife Rupa, children Anushka and Adit. Enjoys golf and scuba driving. Okay, that's interesting. In his free time. So warm welcome to you, Shravan. Today's session will look to your guidance and advice on how healthcare professionals and frontline health workers can address and overcome some of the challenges in today's uncertain times. So some of you have already given us some questions, so I'm going to kick off with those questions already. So Shravan, just to kick off, how are you helping the helpers really, and what steps have you taken for better workforce decisions really?
Nitin, thank you so much. And first off, I've got to thank NatHealth for this series of events, which I think is having some good traction with healthcare workers around. And it's great for me also to sit and listen to some of my peers and colleagues in the healthcare industry speak about their experiences. There is safety in numbers, and good for us to know some of the best practices that are going around. I would like to acknowledge my colleague Shrikant Srinivasan, who walked me through a lot of these issues, since he leads safety for our colleagues also at Wipro GE Healthcare, and I've spent a lot of time with him on the field, and many of our colleagues from Wipro GE are in the field. So we learn a lot from them. We learn from their experiences, what's happening at hospital sites, whether private or public, whether it's corporate or single site. And every day has been a learning experience for us. And some days have been really tough, very tragic. In fact, today, Nitin, is one such day. For the last few weeks, actually, let me take it back to a year. A year ago, it was, of course, a huge challenge, and we were facing a lot of the problems that we're facing now, and many of them were new the first time we were facing those. I think we're a lot better today. But this time around, I feel it has hit us a lot harder. It has hit closer to home. I haven't come across a single family that hasn't been affected in some way. And today we lost one of our colleagues at Wipro GE Healthcare, and that's just really cast a pall of gloom upon our team. Despite the very best efforts that everybody has put in, the premium that we put towards safety, this disease knows no boundaries or barriers and has affected a lot of us. Around India, we've seen massive response, right? Over the last, not just the 4 weeks, the last year or so, 25 million people have recovered from this, and more are recovering as we speak. And vaccination doses are being given by the hundreds of thousands. So we are seeing a good response. To your specific question, I feel very proud that we are in the healthcare industry where we do have an opportunity to play a part in this journey, Nitin. And the medical device industry has worked very closely, not just as one company, but all our businesses have come together with the greater healthcare ecosystem, and it gives us a sense of purpose. I think we are privileged to be in a place where we have a very strong sense of purpose, which creates engagement. And even through these tough times, I know that our colleagues in my company, in the extended ecosystem, have been very motivated and engaged and truly committed to the cause. So I think that's really special, and a big thank you to our frontline champions who have been out there close to patients, close to clinicians at healthcare institutions.
No, Shravan, thanks for that input there. Tell me, how prepared are we to meet? We've already gone through this demand surge, right, which happened last month, and now it's tapering down, or seems to be. Are we prepared enough now to meet a third surge?
Already talking about third surge. Don't.
I hope it doesn't happen, but you know what I mean.
Yeah, I hope it doesn't happen. But then again, when we went through the first surge, we felt that we had crossed the hump, and of course, we expected it to come back to a certain extent, but not to the extent that it did this time around. I think we have a lot to learn from the last couple of experiences, but we also have a lot of resources at our disposal that may not have been there earlier. Simply to start with, through knowledge, and also how we can equip ourselves better for this potential third wave. To start with, Nitin, we have vaccination. I think that's a huge difference that we have now versus previous months, and definitely compared to last year. To your point about capacity, this time around, every time you remove one constraint, whether it's beds or oxygen, some other constraint opens up. It could be one of the medicines, or it could be some other equipment. And I think companies, businesses, and institutions, research bodies are all coming together to address this. And it's my take is, it's not just going to be a simple linear relationship between the number of cases and the capacity that's going to be built, but it's going to be a combination of different solutions that we will offer. For one thing, we need to skill, and the other thing, we need to scale up, right? So how can we skill? We're already doing that. Our frontline workers, as I said, are learning more from each other and from other countries and from teaching hospitals on a daily basis. But we can use technology to this advantage. We have a lot of resources available, whether it's videos or whether it's live training from around the world. People can be very quickly equipped. Whether it's in the lab or the imaging site or at the intensive care unit, there are teaching resources that are available that will help us to skill. The second thing is around scale. How do we ensure that the technology that is available in one of the large cities or a corporate hospital is equally available in a smaller city or a small hospital or a nursing home? How can we use technology to transcend physical barriers? How can we ensure that capacity is extended beyond the reach of a single ICU through technology? And I can speak from our experience, where we've set up numerous tele-monitoring systems, whereby the capacity of an ICU can be expanded, not just across the hospital on different floors, but from one hospital to another, or from a hub in one major city to spokes in various districts. because one of the rare resources that we have are intensive care specialists, and they are not going to multiply as rapidly as the disease is. So how do we ensure that they scale up commensurate to the impact that the disease is having? If an intensivist is typically taking care of, say, a dozen patients, how can they take care of 20 patients without compromising on the care and safety of the patients and of the healthcare workers that are supporting this initiative? So I think technology is going to play a huge role, Nitin. I think education is going to play a role, and of course, other conventional means of expanding capacity while ensuring the absolute safety of our healthcare workers.
Interesting. You talked about technology, Shravan. So can you share some examples? You said there's something happening on how we can best make use of technology, because you're seeing a shift of some of the cases rising in rural India today.
Yeah. So, for example, like one I mentioned, telemonitoring systems whereby we can expand our capacity. Another could be in algorithms that are used to quickly facilitate radio diagnosis, CT scan or X-ray. Of course, we have a capacity constraint in terms of the number of machines or the number of sites where a patient can go, but we'll also face a capacity constraint with radiologists and technologists. So how can perhaps AI-based solutions step in to augment the capacity and help with a quicker diagnosis for the patient, collection, ability to upload results quickly and analyze them quickly? And of course, telemedicine, of course, there is no substitute to a clinician or a nurse working directly with a patient. But under these circumstances, we do have recourse to telemedicine to help to make a diagnosis, to help to monitor the patient and see them through when they are not able to come in person to a hospital or ICU.
This brings me to my next question, which is really about frontline workers have felt stressed and overworked in this time, right? So how do you support these workers? Do they get enough rest? Do they get counseling? Can we use technology for counseling, for example? So what's the best way of helping frontline workers to support them from a more mental health perspective?
Nitin, I'm so glad that you're asking this question, because the health and safety of our frontline workers goes beyond physical health, and I think emotional and mental health is also very critical. First off, I think it's important for all of us to acknowledge that it is okay not to feel okay, and it is okay to be vulnerable, to share, and we're all social animals here, and I think we'll all understand if someone is feeling that stress, and people will step in to support. I think physical and mental health in this case will go hand in hand. We have a lot of tools at our disposal. First off, take care of your physical health, right? Vaccination of yourself, vaccination of your families, and then moving on to other day-to-day activities like daily exercise, meditation, yoga. If you keep physically fit, it can help you to be mentally fit. I personally do at least an hour of exercise every day. And I'm usually joined by my wife, so we make it and kids, and so we make it a family affair. Use this time to decompress and talk about something else while staying physically active. And we're not allowed to leave our homes, but we've rolled out yoga mats and we're doing high intensity training at home, because that gives us that energy, that burst of energy. And then of course we're back, and we're of course we can't avoid a lot of the topics and the grief that surrounds us. But it does help to have those moments. I also think, whether it's other means of physical safety, we're all aware of that, right? Wearing the right and adequate PPEs, masks, suits, etc. To your point, can technology help? Absolutely, technology can help. I actually just got out of a webinar that my company was conducting around healthcare, about awareness and mental health. And last week we had sessions on yoga. We had sessions from experts on mental health who are dealing with depression and anxiety and all of the mental issues and the emotional stress that can come from this, not just for the individual, not just for the healthcare worker, but also for their families. I think it's important for us to utilize technology in order to understand this and to adapt and to improve our ways of care and treatment.
Great, thanks, Shravan. Good to see that everybody's taking care of each other. I think it's important at this time. Um, I think you talked about technology, and the other thing you spoke about earlier was education. Is there, I'm sure overtime, sorry, doing overtime is also putting a risk of attrition of frontline workers, probably. And you need more people, right? So is there an adequate supply to backfill some of this through the education piece you mentioned?
So again, like I said, it's people are feeling vulnerable and they're feeling anxious and they're stressed. They're dealing with a huge amount of stress and anxiety, and probably their family members are saying, "Why should you do that? Why should you go out there in the field? Let's hang back at home." And some frontliners do not want to continue what they want to do. We get it. First off, I should say that health and safety is paramount, right? It's not something that we can compromise on, and nobody can force anyone to go to the front lines. Nobody should do so. And it is always, something that people are doing out of their sense of purpose and commitment. And our industry, people are going above and beyond, and they deserve the empathy and support of the whole system, right? So my take is, of course, and as you alluded to it, this too shall pass. We are going through a difficult wave, and who knows, there might be another wave. I think we do have adequate, educated and well-trained people who can help under normal circumstances. But during a crisis like this, when there is a surge, we do need to expand our capacity, train people at short notice, bring in other folks from allied fields, utilize technology, perhaps utilize support from other countries or other states that are not as badly impacted. And the whole ecosystem needs to come together here, right? And it might be that Delhi is going through a spurt and maybe someone from Kerala can help or vice versa. But I think we need to look at short-term means of urgently expanding capacity, utilizing technology, and then creating a base for, like a reserve corps, if you will, for long-term potential impact and expansion of this disease. And it may not be COVID next time, Nitin, it could be something else, but being prepared for such calamities is something that we should put in some time and effort into thinking about.
No, that's a good point. I think I like the point also about the fact that how we can logistically work this better, right? Because each state has gone through different phases at different points, and moving people around might also be a good idea to kind of balance out the flow. I'm going to move to, talked a lot about on how we're managing people. I moved to another question, which is around vaccines, really. So it seems there's a general resistance amongst the population that some people are against the vaccine or are just hesitant for the vaccine in terms of safety. They are worried about side effects, and even now at this stage, right? So what is your advice, and how do you think we can address this challenge?
So Nitin, I was initially very surprised when I heard about potential vaccine resistance, because all along through last year, we were waiting for some sort of solution, and people were trying everything in the book and outside the book, they were trying that. And when a credible vaccine came out, I assumed that people would be very excited to take them. But I was quite surprised, and this is across the board around the world. It's not just in India, but around the world there is vaccine hesitancy. So rather than just say, "Oh, people have to take it because it's good for you," or make people force people to take the vaccine, we need to take a step back and really understand this. I have spoken personally to several frontline workers, and also as a clinician myself, I speak to a lot of my classmates from medical college, and I hear from them and from their patients and family members about this hesitancy. I think it comes from a couple of different areas, and there are probably some good reasons for it. These vaccines are still somewhat new, and more and more data are coming out. And of course, we have a tendency to highlight the bad news first, and that might be disproportionate to the actual database or the statistics that are available in a trial. I think we need to educate ourselves, really understand what the risks are, And any drug or vaccine is taken based on a ratio of risk versus efficacy. And if the safety profile is adequate and we have enough data to support efficacy, I think we need to go all in. Personally, I'm a very strong advocate of it, and wherever I have an audience to speak to my colleagues or frontline workers, I do encourage them to take it. Of course, it is a personal choice, but it goes beyond being a personal choice. It's a personal responsibility to the people around you also to be vaccinated. So I think it's important for us to continue the education, make sure you take medical advice, understand which vaccine is good for you, and follow the protocols that are laid out by the medical professionals and the medical bodies and the government on which vaccine to take and when. And I think over time, once we see the results, once we see that it is not as scary as some of the news reports might tend to indicate, we will see a lot more vaccine uptake. But this is a problem around the world, Nitin. We don't have an easy solution to it. I think leading by example is important. We need to have a lot more healthcare leaders. I think that the viral selfies were great when a lot of leaders, political leaders, and healthcare leaders were doing this. It encouraged a lot of people to get their vaccine done. Now, of course, there's a shortage, and people wish they had stood in line earlier. But that bottleneck will ease up for sure, and we need to ensure, at the very least, as healthcare professionals, we need to ensure that we and our families are vaccinated, because we could be putting others at risk if we are not vaccinated.
Yeah, I think you're absolutely right. Even I was quite surprised, considering India's one market where we've all grown up being vaccinated and multiple vaccines at an early age, right? So there should not be any that way. But I guess there is what people read, whether it's in some cases it's misinformation, some cases there's too much of information and it's confusing.
Yeah.
So I guess
also, Nitin, there is a logistical problem, right? We are all in lockdown, and you might have to go to a hospital to get a vaccine. And common sense and medical advice tells you not to go to a hospital at this time and risk exposure. So where is that balance that you strike? So that is a very real problem. But now, of course, it has been opened up to other sites where there are not infected patients or inpatients around there. So it has become a little easier to get the vaccine, but there is that mental block saying, I don't want to go out and expose myself and risk getting the infection whilst getting a vaccine.
Yeah, that's true. We've also read recently that the vaccine has been largely effective against the new variants which are coming out of India or the UK or other countries. So just one, your thoughts on the efficacy of vaccination today would be important for people to listen.
So my thoughts are just based on the published data, and I do trust the published data. I've seen data from various vaccine trials, and most of them are reasonably consistent with each other. If you follow the protocol, the number of doses and the period between the doses, there might be some variations here and there, but by and large, I'm satisfied with it. But vaccination alone isn't going to help. We do know that there are documented cases and anecdotal cases of people testing positive for the virus after they've been vaccinated once and sometimes even twice. And but what we do also hear is that the risk of morbidity and mortality post-vaccination is highly diminished. So even though there is a risk of getting positive post-vaccination, the outcomes are still a lot better. And this does not remove the need for us to continue to wear a mask, continue to be socially distanced, and practice hand hygiene for the time being until things get a lot better. I know some countries have removed these restrictions and say if you've been vaccinated twice, you don't need to wear a mask. I would err on the side of caution, at least in our country, until things get a lot better.
Great. And of course, continue to keep wearing the mask post-vaccination.
Absolutely.
Yeah. Shravan, just moving away, we've spoken a lot about COVID and what's happened, but there are a lot of patients out there who have pre-existing ailments. And, I know so many people who've been helpless because they have not been able to go to a hospital for getting their pre-existing ailments serviced or, just looked after. So what happens in a there are non-COVID patients. So some words about non-COVID care now, because I think that's going to become another time bomb otherwise.
Nitin, this is probably the most important issue that we need to look at, right? While we are obviously trying to flatten and diminish the curve and improve our morbidity and mortality outcomes and hospital stay, etc., the so-called non-COVID patients or patients with comorbidities are concerned for a couple of major reasons. Number one, they are, of course, at risk of contracting COVID and suffering worse symptoms than others. But if I'm to read your question correctly, it is what are we doing about them, because they are missing out on the care that they need and deserve. And there are, again, like with vaccine hesitancy, there is hesitancy to receive treatment for routine, non-communicable diseases, your hypertension, or for that matter, more risky conditions, cardiovascular conditions, oncology. And being in the healthcare industry and being in imaging, we are able to track, how many patients come and go for a certain ailment versus others. And again, we have anecdotal information also from our clinicians and the overall healthcare ecosystem telling us that there is a drastic fall in the number of patients seeking care for cancer, for cardiovascular disease. Women are potentially neglecting their health, and of course, many other diseases. You name it, and people are falling behind on their treatment protocols, on their diagnostic protocols, on monitoring, on therapy, all of this. Imagine now if you're taking all these precautions and pains to avoid getting infected by COVID or avoid going to a hospital, but you're in one stage of cancer and you progress to the next, that's going to have a very profound impact on your clinical outcomes, not to mention the cost to yourself, your family, and to society. And this goes across the board. If someone is postponing care for a mild cardiac condition, which could have been treated with a very quick intervention, if you come back a few weeks or even months later, it might be too late. And I think this is where we as industry and institutions, teaching hospitals, we need to get together and say, how are we going to address this? How are we going to ensure that patients get the treatment that they deserve beyond COVID? I think, to be fair, a lot of the hospitals and nursing homes are offering remote care to monitor their patients through telemedicine, teleradiology, etc., what have you. But this is just something relatively superficial, and we are getting data that people are slipping into worse conditions and not being treated. And you use the right phrase. It could be a ticking time bomb that we are sitting on if we don't deal with it immediately and with a sense of urgency across the board.
So how do we make people, feel safe to come back to their doctors, the hospitals they used to go to, or nursing centers they used to go to for whether it was for dialysis or for oncology treatments, etc.
I think some transparency is important here, Nitin. People need to share their data. People need to, the hospitals need to make patients and the general public aware of which of their services are in COVID facilities and which are in non-COVID facilities, and lay out a pathway, make it clear for patients to find the information that they require to seek treatment. The primary physician has probably the most important role to play here, because they are the ones that are dealing with the immediate need and are triaging the patients and either treating them at a clinic or remotely or move them to a nursing home or hospital. I think the primary care physician has a role to play. I think the hospitals have a role to play to make it very clear what the patients need to do, and also share with them the kind of protocols that are put in place for their safety. I visited numerous hospitals between in the last 14 months or so. I visited numerous hospitals, and I have been thoroughly impressed at how we have stepped forward as a nation, as a healthcare community, to treat all patients as potential carriers of the disease. Just as perhaps, 25, 30 years ago, we took universal precautions for HIV. We assumed that every patient entering a hospital or operating theater could potentially be a carrier. And we took precautions such as gloves and other means of sterilizing equipment. We need to think about the universal precautions that we need to take. Assume that anybody could be infectious, but ensure the highest levels of safety and hygiene within the hospital. Give them a safe environment, and then give them reason to come back and show that we can make a difference.
Yeah, I think that's important. I think also, apart from the protocol, I think patients need to understand that they need the care because they need to address their ailments. I'm just going to go back. Some more questions coming in our chat box. One question coming up is do you think India is going to see a rural-urban divide, which is going to result in the third wave?
So actually, paradoxically, I think the rural-urban divide is actually being narrowed, Nitin, in my view, from what I've seen at least. And I'd be curious to know what the other views are. And I think this is largely thanks to technology and also because of communication. People are able to get information a lot quicker today in real time, no matter where they are in the country. And whether it's large chain hospitals or the government or smaller institutions, they are able to reach out to each other and get help, get the help that they require. Supply chain has matured a lot in just the last 1 year. People are able to get a medicine or a medical device across to rural areas much quicker than they were in the past because they see the need, they see the urgency, and they're able to do this. As I mentioned earlier, technology, whether it's AI tools or teleradiology, telemedicine, etc., is narrowing the gap. But of course, there still remains a gap. I think I would be naive to imagine that there is no gap between the urban and rural communities. There still is a tremendous gap. I think we need to do a lot of skill building. We need to continue education, work with a sense of urgency and purpose to make sure that healthcare is distributed equitably.
Yeah, I think I agree with you to a certain extent that we've narrowed the gap quite a bit, but I think there's still some way to go. Do you think another question that's come up from one of our listeners is, do you think a national level task force will help strategize better for the next wave, which includes, of course, the private sector involvement in it?
Yeah, I think the second part of your comment is very essential, right? Whatever task force we have, whether it's national or state level or community level, it has to include all the key participants that can deliver healthcare, whether it's public or private, whether it's healthcare service providers or pharmaceutical companies, medtech companies, even digital companies can really come in and help out a lot. We need to make sure that we have teaching institutions involved because they are training the next generation of healthcare workers who will come armed and equipped with the knowledge that they need to scale this exponentially in case we have another wave. We've already learned a lot from this. We do have national level task force. We have global task force, of course. WHO and the others have these task forces of which we are a part. And this is a global pandemic. Nobody is safe until everybody is safe, right? Is what they say. So we need to ensure that we all are adherent to this, and the other allied industries that could have a role to play. It could be hospitality, aviation. I think they've also stepped forward and done a tremendous amount, Nitin, and need to be consulted for managing potential spikes in this current wave, or worst case, another such wave.
Fair enough. I think you did touch upon this in the initial couple of questions, but this question from one of our listeners again is, what are the lessons from the first wave which we did not consider in the second wave, which led to the tsunami of cases and deaths, like including shortage of oxygen or ICU beds? And therefore, how should we prepare for the future? Is there any learnings now from the first and two waves which we are taking forward, basically?
I think for better or for worse,
hindsight is always good, right? So
yeah, for better or for worse, we have already learned a lot from the first wave, right? And we were able to respond so quickly only because we had learned lessons from the first wave. Supply chain, for example, We know how to very quickly get a product from point A to point B, and deal with all the bureaucracy and administration to ensure get somewhere. Protocols. We've not been experimenting as much as we did last year. I mean, the number of drugs that were put into play a year ago and now have been proven to be either effective or not effective, and that information has now helped to guide the treatment protocols. That's been a huge learning. And I was actually studying some information from insurance reports, and the average cost per claim has started to come down in certain areas, and that's largely a function of better treatment protocols and quicker in and out from the hospital. So that being said, I think we as a nation were a bit complacent. Perhaps we took we took our guard down when we saw that the numbers were really low, coming down to the single digit or double digit thousands. We let our guard down. You see a lot of people wearing their mask on their chin and walking around, and that really does nothing for safety. And even as the numbers, in March, things started to get alarming. The numbers were already doubling week on week, but it was still on a relatively low base, right? When it goes from 10,000 to 20,000, it's still just 10,000 added cases. But when it reached 100,000 and 200,000, we hit the panic button. So we could have hit the panic button a little earlier. We do now, from these lessons, know that we should have thought about adding capacity in every aspect. And Nitin, there will always be some bottleneck, right? That is the theory of constraints. If you had infinite beds, you would not have enough oxygen cylinders. If you had infinite oxygen cylinders, you may not have enough ventilators. So what is that number? Nobody imagined that we'd hit 400,000 cases a day. I think we were adequately equipped for 100,000. Last year's peak was 90-something thousand. I think we were adequately equipped for that, and could have rapidly scaled up to maybe 20, 30, 50% more without seeing much of an impact. But 400% more, I don't think anybody imagined, and we really dropped the ball on that one.
Yeah, I think the virus also became more virulent, so we didn't anticipate that. So I guess all learnings. So tell me, there's I'm just coming back to one of the vaccine questions. One of the discussions has been about COVID, right? And which says that there's a digital way of getting your appointment and then a vaccination. How do we get that access to rural, right? How do we bridge that divide? Because I know so many people, you probably know, who may be using a mobile phone but not have the chance to actually be able to go and actually book an appointment.
Yeah. Nitin, this takes me back to 5 years ago when demonetization triggered the use of cell phones for financial applications. Right? Paytm became a household name overnight, and this sort of difficult moment triggered an improvement in an unexpected area. I think we are going through our UPI moment here in this situation as well, where technology is being utilized a lot. I would say exercise some caution when it comes to WhatsApp University and what that is doing in terms of technology. There's a lot of poor information out there. We need to challenge that and correct it. But I think we are doing a lot better today than we might have been a year or two ago in terms of access to digital means of communication. Is it a challenge? Yes, absolutely, it is a challenge. I think the government has a role to play here. NGOs can step in. The healthcare infrastructure is pretty far and pretty deep. And if we can utilize our, say, Anganwadi workers and other healthcare professionals who have access to patients on a day-to-day basis, we could certainly do this. We've seen in other countries where telecom companies have actually stepped in to educate their consumers, I should say, their customers, on how to take advantage of the healthcare tools that are available. This is, of course, in other disease areas. We've seen that happening in cervical cancer in Australia using the telecom system. So could we think about doing something a little out of the box like that? I think perhaps there are opportunities.
Yeah, you're right. I think we just have to help people get there. And I think NGOs, Anganwadi workers, or companies like telecom companies can play a big role. Absolutely, I agree. I think today I saw the announcement that the government has allowed walk-in appointments, so people can go and walk in and take an appointment and come back on the day of your appointment. So I think that's a good sign. Um, uh, that's an interesting question for you. In the land of you know yoga and Ayurveda, there's been a lot of controversy in the recent past, and COVID seems to have somehow sidelined or there's been all this debate about allopathy versus Ayurveda, right? Top line comments on that.
There is no debate. Follow the science, Nitin. Follow the data. I'm not for a second dismissive of yoga or Ayurveda. I myself enjoy practicing yoga. It helps me relax, and in combination with other forms of exercise. So big fan. And there are some good Ayurvedic treatments where there's excellent data. I'm a fan of randomized controlled trials. And if we have reliable data to support any treatment, I'd go all in with that. So I would just say, please exercise caution, exercise your judgment. This is not to be derisive or dismissive of any type of treatment, but ensure that it is taken with the right expectations, and please follow the science.
Yeah, I think there's been enough controversy recently, and I think you're right. I think it's important to show data before believing or going with something. But do you think traditional medicine like Ayurveda or homeopathy can coexist with allopathy?
So again, here I would say
Happened for many years. So
I think if you consider the courses, the educational courses that they undertake, there's a lot of overlap in terms of, say, understanding the human anatomy and physiology, and we can take advantage of those human resources and train them for a particular purpose based on, if it may be a pandemic, we can take advantage of that. Personally, I feel that they can coexist provided that there is no harm done, provided that you're not neglecting a better option just because one other is presented to you. And do look at the data, look at the science, and take a decision based on what a controlled trial is able to tell you.
thanks. Another very important question, and which we haven't really addressed today so far, is around testing. Right, in a country where testing and screening has always been a challenge, how do we increase that testing piece, right? Because we saw testing come down over the last few months until we got so many cases, and both. I mean, I guess both for COVID and non-COVID, right? Because while you're testing for COVID, which has to increase, you also need the non-COVID patients to go back and do their regular testing, which they used to do. I mean, people who had their regular health checkups every year or every 6 months or whatever. So how do you ensure that we scale it up, which is safe as well?
So Nitin, I think one good thing that COVID has done for all of us is everybody is aware of the term RT-PCR. Everybody knows what antibody means, and so this is really making a difference. This awareness helps, and so people know that testing matters, and whether it's the government looking at testing for the purpose of isolating individuals and then treating them, or an individual or a family understanding the status of their selves, or if you want to travel, people do understand the importance of testing. I think where we need to be careful is what test do you use for what purpose? What are the other tests that you require? Now, if you've tested positive for COVID, you might need other tests like, D-dimer or CRP or interleukin-6. It's important to have that information and then make an informed treatment decision based on that. Again, I bring you back to non-COVID, Nitin, because there are a lot of people who require testing. It might be for cancer, it might be for cardiovascular, and if you are ignoring the tests, either it might be screening, it might be diagnostic, it might be a monitoring test while you're on treatment. Please don't neglect that. It's not enough to just know your COVID status. Please know your overall healthcare status. I think that is really important. The additional question you asked about safety while testing, I think that is, of course, a concern. People are hesitant to go to hospitals, and they are equally hesitant to go to testing facilities and labs because of risk of exposure, and rightly so. You can imagine that when you go to a lab where they are testing hundreds and perhaps thousands of COVID samples, you might also be at risk. And labs are now offering tests at remote sites, at kiosks, at workplaces, and even at home. And I mean, these are some of the most outstanding healthcare frontline workers. You know, they start their morning at 5 o'clock in that very uncomfortable PPE suit, and they're going from home to home collecting samples. And they're maintaining a pretty high degree of hygiene and safety. And I can speak for myself and my family. We routinely use some services because you know, which family doesn't have some sort of pre-existing condition that requires regular testing. So I would say, of course, be safe. All the necessary safety protocols that we speak about, you know, hand sanitization, mask, etc., still count, no matter who is coming and how safe you think they are. But don't miss a test if you need it.
Yeah, you know, Rockefeller Foundation recently came up with the state of testing, tracing and testing report, and they talked about how to use different testing in different spaces. So when to use the rapid antigen test, when do we use RT-PCR, what's the format, and you know, when do we get into home testing, for example? I think, you know, one of the tests has recently been approved. So what's your view on home testing, for example? Is that something which is going to play a big role in COVID?
Yeah. I absolutely think so, Nitin. I'm a strong advocate of patient empowerment, and I feel that knowledge is power. And of course, considering that it is a pandemic, we do need to inform the authorities and make sure that they have all the information on an individual or a family or a community. So in this case, I think it's perfectly all right to share this data for the betterment of society. But if there is a way to safely test with a kit, and if the results are reliable, my worry is around false negatives, which might be possible when you self-test, because it requires a trained technician to obtain the sample. But I'm less worried about false positives, because then you might typically go for a confirmatory test or take action based on a clinician's judgment. So having said that, on balance, I would still be okay with home testing as an alternative if no better or no more efficient way is available to test an individual.
Fair enough. You know, there's another question that's come up from one of our listeners is how do we, and I think you touched upon this briefly earlier, how do we motivate the next generation to take up healthcare as a profession? Because some of them may feel demotivated by what they're seeing today, especially around two things, right? One is just about the sheer exposure and the stress they've seen people going through. One, and two, also, you know, what has the government or have we done enough to take care of that during this time?
Nitin, I think healthcare is going to be very, very different in future, right? What we know as healthcare today is definitely not going to be healthcare of tomorrow. It's going to be very much personalized. It's going to be distributed. So you might be able to receive remote healthcare, and it's going to be heavily tech enabled. So you could very easily be in a tech job and support healthcare. So I think our conventional thought of what healthcare is and healthcare workers are today may be very different in 10 years' time. So I think we owe it to the next generation to think that through. Secondly, I think we are so fortunate to be in an area where we are able to make a profound impact, and we work every day with a sense of purpose. And we see the amazing outcomes that come from the hard work of our frontline health workers. What could be more motivating than having the ability to make a profound impact to society? Having said that, Nitin, perhaps we might lose some people to other areas, and this might open up new opportunities and avenues for people, and we should celebrate that. But as a healthcare aficionado myself, and being part of the ecosystem, I would be very happy to encourage and motivate people. We need to share our examples, share our stories, and bring more people into the fold.
And do you think, how can we motivate them? I mean, you said it's going to be very different. So how do we communicate that differentness in the profession to them? And how can the government support them better?
I think, Nitin, teachers have a role to play. individuals and such as yourself and the organization that you run, Nitin, we rely a lot on you to spread the message and convey the value that healthcare has to society. The government needs to step in, of course, and offer incentives and acknowledge and really support the healthcare workers and their families. And as corporate companies, we have a lot means to do this. We are supportive of our frontline workers and any of our employees that are working in the field to support healthcare. It could be through insurance, or it could be through other means. But we do need to find a way to communicate this. I think between social and conventional media, there are a lot of opportunities. We need political motivation and leadership to support this. That encouragement has to come at all levels, in the political system, the bureaucracy, and teaching institutions, and of course our conventional healthcare delivery systems.
Great. Tell me, you earlier talked about how well we used different treatment protocols, right? We've also seen a recent rise in one of the side effects of treatments, which is black fungus. Do you think that we kind of over medicated people, or do you feel that we were unaware or not able to manage that, or do you think that phase is gone as quickly as it came?
So mucormycosis was not unknown to us. It's always been around, and it has always been affecting people who were and have been immunocompromised, whether it's HIV/AIDS patients or people on long-term steroids, say asthmatic patients, cancer patients, and so on, have always been quite vulnerable. And there's a fantastic article by Dr. Satyanarayana Mysore, of the head of pulmonology at Manipal, that I read just yesterday, which gives us a beautiful overall view of this disease, this opportunistic infection, and how it needs to be managed and how it can be prevented and should have been prevented. I don't want to sort of delve too much into that as it gets into some medical specifics. But the lesson there is we do need to tweak some of our clinical protocols to understand and accommodate the risk. And we need to consider the treatment options, and we need to triage people. There are certain risk factors in the treatment protocols itself, and we can avoid them. And perhaps not all patients need the kind of intensive care that they get that exposes them to this risk. And there have also been some other forms of medication, or steam inhalation, over steaming of the nasal passages have destroyed the nasal passages and rendered patients a little more vulnerable to it. So read the protocols, listen to your clinician, and take a look at that article. I think that will tell you quite a bit about this disease.
That's interesting. Inhalation, yeah, over inhalation can also lead to some side effects. But I guess we're also a country where we self-medicate a lot. That's another problem, right? So we read on the internet and we tend to say, okay, I can have this medicine and that's it. I think that's been another problem we've faced in the past.
Yeah, I think Dr. Google and Dr. WhatsApp have their benefits, but they also have their risks. We need to treat them with caution and always challenge people for the source of information, and make sure it comes from a credible authority before you take up anything.
Yeah, absolutely. I think one other last couple of questions really. Do you think patients now have, over the last year or so, do they think, there was this whole trust issue or trust deficit in the healthcare system in the past? Do you think that's become better during COVID?
I think it really depends on the location and the nature of the hospital and also the patients. You can always sense that there is a lack of trust when there's a lot of anxiety and we're operating in crisis mode. I think we, as healthcare industry, we need to come forward. We need to be a lot more transparent. We need to share data and be very open with patients, with families, with societies about their risks. And I think this transparency will definitely beget trust. There has always been a trust deficit, but at the same time, there is also a lot of yearning for learning. People want to know more. They want, and they already have lots of sources of information. So we need to step forward, provide more, and arm patients with the right information so that they trust the healthcare system better.
Cool. Okay, last question really. If you could give yourself a piece of advice, what advice would you give yourself on what you could have done differently, during this pandemic, during this last 1 year, if anything at all?
Nitin, I myself tested positive for COVID way back in October, and I thought I was being careful, but clearly not careful enough. There could have been ways to avoid it, and my wife also tested positive recently, and she was hospitalized, and that was a tough time for all of us. We speak so much about safety. I've been vaccinated, and yet we're all at risk. I think let's not drop our guard for even a moment, and ensure that we maintain all necessary safety precautions and protocols, no matter what the circumstances. And lastly, I'll leave you with this about emotional health. I think that's going to be the wave that really hits us now, Nitin, is emotional health. And let's make it okay for people to know that it's okay not to be okay. Unless we hear the stories and we share the stories and we provide information and a safe space for people to speak about this, I think it'll be very hard to overcome the mental tribulations that this disease has fostered. So let's take a moment to think about that.
Great, Shravan, thank you so much for your time. I hope you enjoyed listening to Shravan and his words of advice today. Very grateful for all of those who joined us. Join us again on Friday, same time. We'll have Amira Shah from Metropolis joining us. Shravan, thank you so much. Thank you for your time. And we will chat to you soon.
Thank you, Nitin.
Thank you. Misha, can we stop the recording?
I don't think we're live anymore. Hey, Nitin, thank you. This was fun.
Yeah, went well, I think. It was a good discussion. Thank you so much.
Thank you. Anvesha, is there any way of finding out how many people were able to see this?
So, normally I have seen in the last couple of sessions, so very few people are there on the live, but when we put it the recorded session, there are a lot of, day or two, I get around 80 to 100 views. So,
excellent.
Yeah.
Good. Thank you.
Okay.
Thanks, Anvesha. Thanks, Shobha.
Thank you. It was excellent. Thank you so much.
Bye.